Good afternoon. The subcommittee will come to order. Today, we will examine the VA supply chain modernization project. The VA refused to share basic information about this effort until a little more than 24 hours ago, giving us no choice but to hold this hearing. We know the department spends billions of dollars each year on medical supplies and other goods and struggles to manage its inventory effectively. The Government Accountability Office and the Inspector General has written a mountain of reports documenting these problems. There's waste and dysfunction in every step of the process, and it's frustrating to the healthcare providers who expect to get the right supplies in a timely fashion to care for our veterans. The broken supply chain was on full display in 2020 when COVID-19 caught the VA completely unprepared, and medical center managers were desperately compiling and exchanging inventory lists and rationing supplies to their frontline staff. After that, the VA attempted to install the Department of Defense's medical supply chain system, but had to abandon it in 2022 when it failed to meet most VA requirements. More recently, the VA put together the Supply Chain Modernization Project, which is even more ambitious. I absolutely agree that the VA needs to modernize some key systems and connect purchasing to inventory and payment. But the department already has a project to do that called Financial Management Business Transformation, which we have had several hearings about and is struggling to finish. The Supply Chain Modernization Project is a gigantic effort, the likes of which we have only seen in the EHR, and we know how that has turned out. It would not only replace the systems I mentioned, it would try to knit together all-encompassing system to manage every aspect of a unified VA supply chain, from tongue depressors to X-ray machines to printer paper to headstones. The VA has been soliciting proposals from contractors to do this for nearly a year. Now we're hearing that a contract award is imminent, but we still have only a rough idea of what the project may entail. The life cycle cost estimate is stratospheric, huge. And there does not seem to be any approved budget. The effort may extend for a decade, but there's no schedule. The concept is grandiose, but there's very little detail about how it might be accomplished. The VA may actually be preparing to pay a contractor to finish writing its work plan and schedule. May, you hear, may. But we don't have any details about this. Our witnesses will assure us the VA's financial liability is limited. However, I'm concerned that, in effect, the government will be paying a contractor in order to find out what the government will be buying from that company. That doesn't bode well. I can't be the only person that sees this conflict. In the real estate development business, if you start a project without blueprints or a budget, you are sure to end up with a half-built, empty building. This is much the same. Without a doubt, the VA and the veterans it serves would benefit from a functional inventory management system. And the department could make better use of taxpayers' dollars if the system used to order medical supplies were connected to the systems that pay for and track them. However, what is described in the VA's request for proposals seems to be a bureaucratic, empire-building mega project. This needs to come down to earth before it's too late. We have had expert testimony time and time again come before this committee and say these large software programs don't work. We need to break it down into smaller bites and allow competition to bring the prices down and the strongest vendors to come forward instead of relying upon 2 or 3 of the largest vendors that continue to show up before us that are not delivering on what they are supposed to. This subcommittee expects truthful and complete answers so we can carry out our responsibility to make sure VA's IT modernization efforts are on solid ground and prevent more costly failures. With that, I would like to yield to Ranking Member Sheriff Liz McCormick for her opening statement.
Thank you, Mr. Chairman, and thank you to our witnesses for being here today. This committee takes up many important issues, from ensuring quality healthcare access to efficient and effective benefit delivery. Underscoring many of these efforts is a timely, successful, and integrated supply chain process. The Veterans Health Administration oversees 170 medical centers that serve over 9 million veterans. VA is one of the most largest purchasers of goods and services in the federal government, both in obligations and number of contract actions, spending tens of millions of dollars on medical equipment and supplies, construction, and other purchases each year. In my 14 years as a healthcare executive, I've seen the importance and necessity of an accessible and effective supply chain system. Without these tools, the hospitals remain ill-equipped to handle the demand. This became painfully evident during the COVID-19 pandemic, when VA facilities were forced to use Excel spreadsheets to report PPE inventory up to the central office. VA patients and providers deserve a modernized supply chain, resources, and it has yet to be proven that VA has the capacity to provide this solution. The COVID-19 pandemic also revealed long-standing vulnerabilities in VA's aging supply chain management system, which led to gaps in the availability of essential supplies and equipment for patient care and safety. VA's attempt to modernize this system through the Medical Surgical Prime Vendor Program and the Defense Medical Logistics Standard Support, or DMLSS, system have been lackluster at best. Government accountability offices VA ultimately enlisted in using the DMLSS and is currently in the final steps of procuring a new contract. Last year, VA testified that it was far along in the process of selecting a modernized, enterprise-wide supply chain and logistical management tool, at least in its third attempt to provide these key services to VA. Yet VA is still operating off a cold-bolted together system as we wait for this new contract to be awarded. Chairman Rosendale's IT Reform Act, which was passed last Congress, thanks for the support to this from this subcommittee, requires VA to submit information regarding contracts for major IT modernization projects prior to the award of these contracts to ensure adequate congressional oversight. However, VA has not labeled the supply chain modernization effort as such, leaving the committee largely in the dark regarding to this contract. To this end, in preparation for this hearing, committee staff have been requesting briefings on the supply chain modernization effort for months. However, VA has dragged its feet on getting information to us in a timely manner. For instance, to date, we have yet to receive an official briefing on this project. Further, just 24 hours ahead of this hearing, VA dispersed nearly 200 pages of documents connected to this supply chain project and forthcoming contract award. This is unacceptable. Large modernization efforts, specifically those that are highly integrated across the VA enterprise, such as electronic healthcare records and supply chain modernization, require the full breadth of VA support. VA must maintain a leadership role in the modernization and not allow its vendors to dictate product requirements, success metrics, and implementation plans. I acknowledge VA's assertion that this project is one that expands beyond the Office of Information Technology, spanning across the VA's enterprise. However, I remain concerned that the Office of Acquisition, Logistics, and Construction is leading this effort rather than OIT. I look forward to hearing how VA has strengthened its acquisition framework requirements following DMLSS setbacks, and how they plan to develop specific requirements for the eventual vendor of this supply chain modernization solution. I do believe VA can be successful in this effort if they communicate requirements and resources related to programs effectively. And as of now, we haven't seen that effective communication. Thank you, Mr. Chairman. I yield back.
Thank you very much, Ranking Member Surplus McCormick. I will now introduce our witnesses on our first and only panel today. First, from the Department of Veterans Affairs, we have Chief Acquisition Officer Michael Parrish. We also have Dr. Ronald Miller, the Deputy Assistant Under Secretary for Health and Support. Finally, we have Principal Deputy Chief Information Officer, Mr. Dwayne Beard. The Acting Executive Director of the Veteran Affairs Logistics Redesign Program, Ms. Chanel Bankston Carter, is not appearing to testify today. And it is deeply concerning that the director of the office running the project that we are here to discuss has either refused to appear or has been prevented by the VA from doing so. We will continue to pursue that matter. I ask the witnesses, please stand and raise your right hands. Do you solemnly swear under penalty of perjury that the testimony that you are about to provide is the truth, the whole truth, and nothing but the truth? Thank you, and let the record reflect that all witnesses have answered in the affirmative. Mr. Parrish, you are now recognized for 5 minutes to deliver your opening statement on behalf of the VA.
Good afternoon, Chairman Rosendale, Ranking Member Sherfless McCormick, and members of the subcommittee. I'm pleased to appear before you today to discuss VA supply chain modernization achievements thus far and next steps for this critical initiative. Joining me today are my colleagues, Dr. Ronald Miller, Deputy Assistant Undersecretary of Health for Support for the Veterans Health Administration, and Mr. Dwayne Beard, Principal Deputy Assistant Secretary for the Office of Information Technology. VA supply chain's mission is to ensure cost-effective, clinically focused delivery of the highest quality care and benefits with the greatest value and customer experience for our veterans, their families, and our VA's workforce. The success of this mission depends on the input and support of VA's many stakeholders, and we're committed to engaging them throughout this process. This includes Congress, and I welcome today's discussion with you to provide an update of this critical project. Modernizing today's VA supply chain is much more than just mechanically deploying an IT system. It also presents us with opportunities to transform the way we fundamentally do business and deliver healthcare in VA. It also allows us to standardize that delivery using an integrated approach to achieve improvements in patient safety and efficiency, all while focusing on human-centered design to ensure user acceptance across the enterprise. It's also important to note that there is no singular technology solution that will modernize VA supply chain because VA supply chain is not a singular system, but a combination of multiple component supply chains, including but not limited to facilities, high-tech medical equipment, IT, medical supplies, the National Cemetery Administration, pharmaceuticals, prosthetics, and the Veterans Benefit Administration. Through this supply chain modernization effort, VA is changing how complex systems are acquired in VA by incorporating lessons learned from previous programs, as well as the GAO and OIG, as well as industry recommendations to ensure success. Additionally, we're using the supply chain modernization program as our initial pilot for the deployment of our new acquisition lifecycle framework process known as ALF. ALF aligns acquisition and program management practices with laws, regulations, and policies, including leading industry acquisition standards. This has been and will continue to be a deliberate, field-driven, iterative process in that the project has to complete multiple milestones before we fully commit to spending taxpayer dollars in deploying the expected enterprise solution. This effort has been ongoing for several years now, which is necessary to get the hard decisions right before we commit taxpayer dollars. For example, in September 2023, VA appointed the VHA as the Supply Chain Modernization Executive Agency and chartered the VA Logistics Redesign, or the VALOR Program Office, to oversee this supply chain modernization program. VA also established an Enterprise Supply Chain Board, known as ESCB, to integrate VA supply chain efforts under a single governing body to bring together the goals, governance structure, and roles and responsibilities of this program. The ESCB also governs the overall enterprise effort by establishing supply chain policy, alignment of enterprise supply chain operations, and standardizing systems and data management. Additionally, VA conducted an enterprise assessment of our existing supply chain structures, processes, and technologies. This was followed by a visualization of what VA needs to modernize the supply chain. And finally, we established measurable outcomes to define what success looks like when we get there. All of these were required building blocks prior to getting to the final decision of determining the appropriate industry solutions needed to accomplish this modernization. We've also recently completed a rigorous phase solicitation that culminated with a prototype evaluation by our field users. And any acquisition will be an indefinite delivery, indefinite quantity, or IDIQ, cloud-based services contract. It's important to note that only Task Order 1, the validation phase, has been approved through the FTAR process led by our Chief Information Officer. This initial phase will last no longer than 5 months, and it's designed to validate the winning bidder's proposal, as well as define the pilot phase and establish incremental deployment strategy. Upon completion of this initial phase, VA will accomplish a milestone review, including, again, a FTAR compliance, to determine whether to proceed with our pilot phase. Like the solicitation process, the pilot phase requires our industry partner to conduct a technology demonstration and satisfactory user acceptance testing by our field users before we commit to full-scale deployment, by functionality, not location, of each component. Upon completion of these initial phases, a go, no-go milestone review will be held to determine if this effort should proceed to the next phases, which are deployment and sustainment. Completion of the pilot milestone review will also inform determination by the CIO of this program being designated as a major IT project pursuant to the Cleveland-Dole Act of 2022, which VA has not yet assessed this program as a major IT project. VA remains committed to getting supply chain modernization right for veterans, and we aim this to serve as a model for innovation, applying industry best standards with an eye towards adapting for the future as veterans' needs evolve. To that end, we are committed to working with VA stakeholders, including the subcommittee, to accomplish this important initiative. Chairman Rosendale, Ranking Member Sherfless McCormick, and members of the subcommittee, this concludes my testimony. Thank you for the opportunity to speak about VA supply chain modernization, and my colleagues and I are pleased to answer any questions you may have.
Thank you, Mr. Parrish. The written statement of Mr. Parrish will be entered into the hearing record. And we will now proceed to questioning, and I recognize myself for 5 minutes. Mr. Parrish, why isn't someone here from the VA Logistics Redesign or Valor Program testifying today?
Thank you for that question, Congressman Rosendale. We do have Dr. Miller, who is the lead of that Valor office in part of his role.
Okay. Mr. Parrish, Dr. Miller, or Mr. Beard, have any of you read the contractor's proposal for the supply chain modernization project or otherwise familiarized yourselves with the details about what the VA is about to buy?
No, none of us are involved in that solicitation effort.
So we've got information that was presented to us yesterday afternoon, several hundred pages, dating back to December, that you actually had access to it. This is information that I've been trying to get for a year. Do you understand how insulting it is to this committee and to the taxpayers to come up here and deliberately uninformed to be the folks that are supposed to be the face, the front of this project?
Yes, sir, I believe so.
Mr. Parrish, almost a year ago, I sent a letter asking VA to comply with the IT Reform Act and report this project's cost, schedule, and the objectives. You and your colleagues repeatedly insisted that you do not have to report to Congress because the project does not meet the major IT project threshold of $1 billion in life cycle cost. Lo and behold, yesterday afternoon, the VA finally produced some of the documents, and the life cycle cost is somewhere between $9 and $15 billion. Mr. Parrish, please explain to me why you believe this project is exempt from the reporting requirements.
Thank you for that question, Congressman Rosendale. The key reason it's not considered a major IT program yet is because we've not established a firm budget or a firm schedule, and that's the way we've structured this organization and this process to make sure that whatever we decide to do is established and has been validated up front. So the very first phase, once this contract is awarded, is to ensure that
Mr. Parrish, if we just received documents yesterday that you've been sitting on for several months. Sure. That says that the life cycle cost is going to be somewhere between $9 and $15 billion. How can you exempt yourself from that when the legislation and the law says that you were supposed to report?
Well, first of all, that was an initial cost estimate, and that's a working estimate that is changing as we get more information. So there's a significant amount of assumptions that have been found to be ultimately incorrect, and so that's not a valid budget to be able to commit to yet with VA.
Did the VA design the project specifically to avoid those reporting requirements? The process?
No, sir.
I'm still befuddled, Mr. Parrish, when you have documents, again, that you've been sitting on, that we've been trying to get, that you've intentionally been keeping away from this committee, that shows that you are well over the amount that the law requires you to report, and that you are keeping it from this committee. I don't see how you can tell me that you're looking at scaling back the program to the point that it's going to get below. You're going to take 1/10. You're going to take 90% of those costs and somehow eliminate them?
Well, Congressman Rosendale, to use your comment that we've talked about multiple years is your concern that this is too big of an effort. And what we're doing is we're modularizing this. So think of subcomponents as I talked about. Each one of those are separate technology solutions. And we're doing it as a service, so we're not buying any hardware that otherwise will be obsolete over time. So we have that flexibility based upon integrating with other major programs that we have in VA to assess that at a later time.
Mr. Parrish, according to the documents the VA provided, you will be asking Congress for hundreds of millions of dollars every year until 2043 for this supply chain project. Do you think that hiding information until you're forced to provide it the day before you testify under oath inspires confidence in this project and your management?
I'm sure you can see it that way, Congressman, but I will tell you, we're not committed to hundreds of millions of dollars per year on this program yet.
Yet. Mr. Parrish, you're not being forthright with this committee when we ask you for information about what you are even planning. You have not come forward and presented a reasonable plan that we can sit down and have a conversation to try and help the VA. And that's where this committee gets very upset. I will now yield back to Ranking Member Surplus McCormick for 5 minutes of questioning.
Thank you, Mr. Chairman. I just have one follow-up question. Could you please go through the budget process of how you came up with that estimate? You made a little comment earlier when you were answering the chairman's question about how you came up to that estimated amount that you provided to us last night.
The initial life cycle cost estimate, part of the documentation that were provided or the new requirements we've established through this rigorous and methodical process of the acquisition life cycle framework. And so one of those components is to get an initial life cycle cost estimate. And so working with the teams and working with the functions of the enterprise, because that's another big difference in what I consider a major success in VA, working transparently and jointly across the enterprise. It's the field and it's those functional areas that establish what we call objectives, not requirements, but objectives, to be able to assess that. And then the cost estimate was established based upon some major assumptions initially that we've subsequently found out are incorrect, that put that based upon previous experience and other efforts.
So what would you say that budget is now?
I think that's still a work in progress, ma'am.
So are you certain that it doesn't meet the threshold for reporting?
I'm not convinced of that yet, no.
Okay, because the documentation that we received does say that it meets the threshold, so we're trying to figure out why is it that you came to the conclusion not to report. If at this moment you're not substantially sure that it meets below the threshold, the documentation says that it meets the threshold, where is the ambiguity that makes you think that you didn't have to report?
Well, it's the uncertainty. We don't know that it's going to meet it or not meet it. I mean, the initial assessment has some hard assumptions that's allowed us to change. As I mentioned, we're using this as a service-based contract. We're not buying hardware. Mm-hmm. And some of the assumptions, if you look in there, assume that we're buying billions of dollars of hardware. We're not.
So the main assumption that you have to negate it is that you're not buying billions of software? Is that what it is? Because I'm trying to see where the ambiguity is so we can understand.
Sure. The uncertainty is understanding the actual technology solution that's going to be provided to be able to achieve what we've asked to do. And that's exactly what the validation phase is for, is we've gotten the proposal. There's an apparent winner. None of us know who that is yet because we've not awarded that contract. And when we're ready to do that, that first phase, that apparent winner is going to have to validate what they had proposed to us for what they think the technology is.
So then you believe that the reporting standard is meant to be after you give the actual contract and they give those numbers? We
anticipate it actually being after the pilot phase, because the other greatness of the way we've structured this is the flexibility that we're not obligating taxpayer dollars without fully understanding what our veterans are going to get and our workforce are going to get for a solution. So if the solution doesn't work after the pilot phase, so the first phase is to validate that what's being offered is indeed what they're going to deliver, as opposed to changing assumptions or applying more risk back to government. If they pass that threshold, we have another go no go milestone. Do we continue this project or not? Assuming they pass it, then we have them do a pilot, in DoD terms, low rate initial production, a singular location per component. Not this massive, silver bullet, as we say, so per component, say for a inventory management system. And then we would have the field come in and test drive whatever that inventory management system. At that point, knowing what that technology is, because technology obsolescence happens.
I understand what you're saying, but I just want to lean back onto the letter of the law and what the actual act was designed to do, which was to create a transparent conversation and relationship between Congress and the VA, and that isn't being met. And so we just want to make sure that that reporting is being met. And right now, with everything you submitted to us and everything you just mentioned, it has met the threshold. I haven't heard anything yet to say that, with a substantial certainty, it has not met it. But I do want to shift over. I just want to give you an opportunity to explain that, because everything we're looking at says you have met it. So just switching gears a little bit to talk about the Reform Act compliance. Last Congress, we were able to pass the IT Reform Act, which provided guidelines and support for the VA before it began its new large IT modernization project. Is the VA actively complying with the IT Reform Act for its major IT projects?
beyond supply chain, you're asking, ma'am?
Yes.
I believe we are, and I'll pass that to Mr. Beard if he wants to clarify that.
Yes, ma'am. Well, the two major other projects are EHRM, Electronic Health Record Modernization, and our Financial Management Modernization Program, and both of those are reporting.
And what are the guidelines for what the VA determines to be a major IT project?
We are using the letter of the law as passed, and I could go back and talk about why this project, we feel at this point, does not yet meet the threshold. So the initial cost estimate was unconstrained, based on no particular assumptions, and was provided to us by an independent contracting organization that looked at everything we could possibly want for a supply chain project. And as you can see from the estimate provided, it is quite large and unconstrained. Then we went through the solicitation process, evaluating what really is the realm of the possible. And then we scoped, so after we get a particular vendor that seems usable, to work with them in the validation phase to understand, with a very modest $5 million, to see what would be possible. And then from that unconstrained universe that was actually unreasonable, to come back to something more constrained. We only believe after we get that nailed down would we be able to, with confidence, have a better budget and then come forward.
Before my time runs out, I just want to ask you, could you explain why the supply chain doesn't meet that threshold?
Because right now, in our budget, we don't have any budget beyond $23 and $24 to put towards it. And we don't yet know what we could put in that budget. So right now, it's under 50 million that we're looking at. So we don't really feel that it's risk enough, and we don't feel like we have enough information to give you to have a useful conversation yet about the project.
I yield back.
Thank you very much. I recognize the representative from Texas, Soph.
Thank you, Mr. Chairman. If I'm right, at least 4 major areas in VA have been addressed recently. Construction was taken away from the Veterans Administration and given to the Corps some years back. We're dealing with the EHR today, massive failures there. You're trying to do financial management upgrade, I believe, as a major project, and now we're adding an IT major project. So even if we do away with the construction, you've got 3 major projects going on, and this seems to be a major IT project, regardless of your protestations to the contrary. If I read the history right, your system, your GIP, which is abandoned, mainly, many people keep their inventory manually today. You attempted the catamaran, which was abandoned in 2017, and you adopted the Defense Medical Logistics Standard Support System, which was abandoned in 2022. And now we've got the Valor program, which you're going to try to establish. I can't reconcile, you intend the new contract to be 10 years in length, and yet you tell us that you're going to spend between 12 and 15 initial estimate between now and 2043, which is about 20 years. So I'm trying to reconcile all the information we've gotten from the committee staff here to see exactly what is truth. And then you say this is a services contract, and yet your 7th, what do you call these things, objective, talks about optimizing warehouse processes and bulk inventory tracking. And then your number 8, which is more important, is involving the purchase, maintenance, and replacement of medical devices and equipment and their components. So are you purchasing medical devices and equipment and their components, or are you contracting for the services by those devices?
So Congressman Self, for the latter question that you're asking about, are we purchasing medical devices and products? We're absolutely doing that today, and that's what we're buying. That's part of medical service prime vendor, and it's also buying some of the high-tech equipment and other things. The supply chain services contract is about creating that backbone to be able to get us that enterprise visibility into order management, asset management, IT, or inventory management, as well as supply chain risk management. And,
yeah, and number 9 is your IT hardware and software. So one of the weaknesses that apparently you determined was your organizational structure to even support this huge contract. So why are you moving forward? My question is, why are you moving forward with even a pilot if you don't have the organizational structure within the VA to handle this huge contract?
I'll have Dr. Miller answer, but first I'll just highlight that a lot of the documents, and I acknowledge that we could and should do better on being more timely in providing documents, but you realize a lot of these were written and established back in 2021, 22, some of the earlier times, and I think we're in a much better place over the last 2+ years. And Congressman Rosendale, as we had these different hearings, we've talked about as we're going through this process, and we've delivered what we've committed to as far as establishing that roadmap to get to the point that we're at. But from a people standpoint of resources, I'll pass it to Dr. Miller.
Congressman, currently the VALOR program is sufficiently staffed for its current activities, and as the supply chain modernization effort progresses and we identify the need to increase the staffing, we will appropriately do so expeditiously.
Okay, before I run out of time, what is the output of the 5-month contract? You talk about stakeholders. In 5 months, how are you going to get significant input from your stakeholders? And I assume that's more than VA headquarters.
So I will ask Congressman Self, is some of the great wins we've had in this project, beyond just the IT, because remember, technology is the last decision in this effort, and that's where we are. The first steps were that jointness and transparency and establishing what success looked like, and we had that established. So those requirements, those objectives were developed by the field and tested by the field. This 5-month initial validation phase is to then create a work breakdown structure and a commitment by the vendor working in partnership with us to deliver what we've asked for to ensure we get a level of comfort in our decision-making before we commit to spending, again, taxpayer dollars. So that first effort is to validate, because we've seen too many times around federal government when projects are, they look good on paper, and then when they get delivered, you have change orders and you have everything else. And we're trying to avoid that from lessons learned from previous projects and previous efforts.
Okay, before I yield, I will just say every IT project for everyone that does a IT project, remember it's always over budget, over time, and less capable than suggested. So just remember those 3 principles of IT projects.
And Congressman, I'll acknowledge that that's the reason we canceled the demos program, exactly because of that.
Thank you very much, Representative Self. According to the life cycle cost estimate, the site hardware and infrastructure total is $1.1 billion. And if you take that out of the cost estimate, you're still looking at a $14.7 billion obligation by the taxpayers. So I think it was you, Mr. Parrish, that said that the numbers included a lot of hardware. Remember, maybe it was Mr. Beard, one or the other, said that that was not going to be a necessary investment, that could immediately be taken off the bill, if you will. That still is leaving us with $14.7 billion, which is well within the amount. It's 14 times the amount that you would be obligated to come before this committee and have this conversation about. So, Mr. Beard, my question to you is that, have we dramatically narrowed the scope of the request of the work that's going on? Because again, we're talking about an enormous project. And if you're going back in and trying to modify and massage these numbers, there's a dramatic difference in what has been requested and what is going to need to be requested in order to fall within the guidelines that you're not obligated to come before this committee and start making requests and have a conversation about what is going to take place or what is not going to take place, or in your words, what would be possible. So are you trying to talk to the contractors about what would be possible to get below the $1 billion range? Are you talking about what's going to be possible in the scheme of technology to deliver a system? Because one means that you should be before this committee on a regular basis giving us our updates, and the other isn't. So where are you landing on that, and what are we to expect?
Well, Congressman, let me jump in first, and I'll pass it to Dwayne. Again, I'll just reiterate that this is a services contract, and we're not committed to what is on that piece of paper that you saw originally from
Well, then why is that the only information that I've received? Because that's the information that we've received, and that's what we have to base our questions upon. Because quite frankly, you have kept us in the dark on the whole system and providing us what in the heck is going on.
Noted, Congressman.
So Congressman, to return to your question, as I said before, the initial estimate was all the universe of the possible. As you know, our budgets are quite constrained. And we have, as Mr. Self said, we have plenty of other projects that are competing for those limited budget dollars.
So are we looking to narrow the scope of the work? Or are we looking to start having a good, honest conversation with Congress about what you're going to develop?
We first need to understand the scope and understand what is affordable, what are the foundational things we must do in order to get a great result for veterans and those that are being served in VA.
Simple
We need to
question, Mr.
understand that
Beard.
first.
Are you narrowing the scope so that you can get down below the $1 billion level? Or are you going to be coming forth and being forthright with us about what you're planning to do?
Congressman Rosendale, our goal is not to game the system and attempt to get below the reporting threshold that's in law. We are trying to understand what it is possible for us to afford and then roll forward.
So then we should be expecting to get regular reports from you because clearly you're not going to get below that $1 billion level. Okay?
Absolutely,
And
sir.
then what the other thing is I want to make sure that we are exceedingly clear about any kind of proposal that starts getting structured that says, and this will be added on later, and this will be added on later. Those costs are all going to need to be identified up front because we are tired of going through a process where the software companies continue to milk the American taxpayers on change orders and additions later on that we are not aware of what the prices are.
Absolutely, Congressman, I agree with you completely.
So we can establish then that this is going to be a program that is going to be well above the criteria that is necessary for you to be reporting here.
Absolutely, Congressman.
Okay, so we're going to be looking forward to having those. Dr. Miller, which of these systems are you planning to keep? Oh, I'm sorry. I need to go. Are we ready to bring the honeycomb up? I'll do that on the next round of questioning because it's going to, yeah. So we'll get ready for the next round of questioning. I'm going to go ahead and yield to Ranking Member Surplus McCormick.
Thank you, Mr. Chair. My question is for Mr. Beard. It seems that VA is increasingly moving its major IT modernization efforts out of the Office of Information and Technology. What concerns do you have with this trend? And do you feel that the business lines have the requisite capabilities to develop these efforts?
Well, I really appreciate the question. So, in my experience, whenever IT has tried to lead a project, there is significant pushback from stakeholders and end users. The perception is often that IT is trying to do something to the user community that forces changes in business practices and is uncomfortable for them, which leads to many projects failing because users fail to adopt them. So what we've determined in VA is it's better to partner with the stakeholders and understand what the outcomes are that they're after and bring them along every step of the way so that they are driving the outcomes that any technology solution must deliver. So that they're owning the requirements, they're understanding the changes in business processes that may be required in order to implement a technology solution effectively. So while it may seem unorthodox to have IT not at the helm, rest assured we are integrated fully throughout the process, but we are letting the business lead the requirements and the change management so that they feel complete ownership of the project. Gartner and others say a best industry practice is to have a unified team where there's no separation between the business and IT as we develop, especially these large projects that will have a significant impact on business processes.
So you don't have any concerns?
I have concerns about the past as well as the future. Every IT project, especially one of large scope, is fraught with risk. It requires active management and constant attention. That's why we show up every day, shoulder to shoulder with our business partners to work on this project. It's not something we do as a part-time effort. We're dedicated to making this work, as we are with EHRM and FMBT.
Mr. Parrish, in June 2023 letter, the Secretary noted that the supply chain modernization solution will seek to facilitate enterprise-wide integration and data sharing between other VA modernization efforts like electronic health records and the Financial Management Business Transformation Program. We've already seen delays occur with the FMBT program due to forced interdependencies with EHRM and the previous supply chain modernization efforts. How does VA plan to align supply chain efforts with the EHR in the midst of these nationwide pauses?
Thank you for that question, Congressman Sherflus McCormick. I will add to the earlier question also, I will say that part of our acquisition maturity and acquisition processes that we're putting in place around governance, I think that we're very comfortable working across the enterprise with the OIT team as well as the functional champions, if you will. So to your point specifically about how we're integrating with other programs, part of the maturity, again, is developing that integrated master schedule and saying, here's where supply chain fits. So supply chain is what we've established, working already with the HRM program and FMBT program, is they are the leads on their current efforts because they're ahead of supply chain. And so technologically, that we have to meet their requirements, that whatever it is at that point. So we're not going to disrupt that, and we're not going to go back to the change orders, and we're not going to make a lot of dependencies on vendor lock, if you will. We want to keep the maximum flexibility to the government to minimize those taxpayer dollars and the reuse.
And how does the fact that VHA is currently using 2 different EHRs and the lack of a baseline EHR impact plans for supply chain modernization?
Sure, go ahead.
So the integrations that we have with our legacy systems, including our financial management systems and our legacy inventory systems for the EHR, have already been worked through at our initial sites. So those interfaces are well established and are functioning today. So that is already well known, and we have a clear path for the same interfaces or same types of interfaces for any supply chain modernization effort. So we're really clear about what's required for both electronic health records for use of any supply chain modernization.
Mr. Beard, according to VA's Office of Inspector General, one of the main operational gaps was the deficiencies in managing data and information sharing. How does the VA plan to reinforce the privacy of veterans' data in the new supply chain modernization solution?
Right, in cooperation and collaboration with our Data Governance Council and our Chief Data Officer, we're baking privacy and security in at the beginning. So we're looking at categorizing data as private or secure based on what it is, where it rests in the systems that it's in, and then flowing through data loss protection around those as they're used by individuals based on their role. So that's part of our enterprise data warehouse and data management strategy and the technologies we're building today.
I yield back.
Thank you very much, Ranking Member Sherflus McCormick. I now recognize the gentleman from Texas. 5 minutes questioning.
Thank you, Mr. Chairman. I want to go back to the governance. You said, Mr. Parrish, that you corrected the governance several years ago. When did you identify the weakness most recently to us?
Are you addressing the DIMLS program, sir?
I'm addressing your needs statement, your business and mission needs statement. I believe it was written this year, in January of this year, and identified the weaknesses in your governance program. So I question your memory on when you actually identified the weaknesses that you're going to have to correct. So how in the world, I want to ask you what you mean by the analysis said you're going to leverage the supply chain program to gain consensus from all of your stakeholders. I don't even know what that means. You're going to leverage this supply chain program that we are developing on the fly now to gain consensus, or you're going to gain consensus before you move forward?
We already have consensus and are gaining consensus as we continue this process across the enterprise.
Okay. Before you go to your validation phase, you've gained consensus. If I went to the VISNs, the various VISNs, all of your offices, they would agree that what you have outlined is what they want, what they need.
And Congressman, I will defer to Dr. Miller to validate that, but we have part of what we've done here successfully is ensure that the field from the very beginning is involved in the decision making as well as involved in the establishment of those objectives.
When did you establish Valor?
Valor was established before DIMLS. It was the program office that was running the DIMLS program before we stopped that, and they transitioned into operating here.
That's right. Evolved from the failed DIMLS. Is that the way you say it?
DIMLS, yes, sir. Defense
DIMLS,
Medical
okay.
Logistics.
But you transitioned in probably 22 or 23.
22, yes, sir.
22.
And so what we did is we took a step back after we saw how Dimmels was over budget, behind schedule, and not delivering what was needed in the field.
Those are my 3 points.
Yes, sir. Cost, schedule, performance. That's what we believe in.
I'm telling you.
Absolutely. So
That's what we're going to
the
see here.
secret sauce.
I question the fact whether you have consensus in that short period of time.
In the last 2 years?
Absolutely.
Okay,
Because you're still designing the program. You can't even give us a budget, which means you do not have the program designed. De facto.
I respectfully disagree with that, Congressman, but I'll pass it off to Dr. Miller.
Congressman, I'll go back to your earlier question and answer both your questions. The field has been involved since day one, and I'll start back from governance, on your question on governance. And the gap analysis that was completed in early 2023 identified the need to restructure the governance. Because of that, we've established an enterprise supply chain board that is represented by every administration and every program office to include having a network director on the supply chain board as an advisor who keeps the field abreast. We also keep Greg Goins from Vision 9, network director. He is also the person I keep informed throughout the process that informs the field. Not only do I inform the field through him, I inform the field through VHA, small group meetings, and established governance boards as well.
Okay, so let's explore that. The supply chain board I was going to ask you about, because that's something that VA does very well, establishes new organizations to do things that you have been doing. So if I went to Jason Cave, the director of the Dallas Big VA, what is he going to tell me about this program? What is he going to know about this program? The director of the second largest VA medical center in the system.
So I would not, Congressman, I would not speak to what he knows, but I will tell you that he is aware of the supply chain modernization effort. He has been, the field has been involved in that to include the acquisition process as well, and as we establish governance. I could not say what he knows and does not know.
I'm going to ask him, Dr. Miller, because I think that's a great way to figure out who knows what. If you tell me that you've got consensus from the stakeholders before you even do your 5-month validation, I think you used the word, I'm going to ask Jason Cave what he knows about this program, and I think we ought to probably ask that question of all of the VISN directors, just to see what the field knows before we go further, Mr. Chairman. I recommend that. I yield back.
Thank you very much, Representative Self. I find it fascinating that we sit here and you claim that this wasn't necessary to bring before this committee, and yet then as you sit there and talk to Representative Self, you say that we have had these discussions with all of these key players, and we've been gathering all this information, and we have documentation that shows that you have financial information brought, but yet you tell us that we really weren't committed to anything yet. So that is double speak. And the American public is sitting here listening to this, and they're hearing you say, we did all this work, we got all this information, we got all these estimates, and then you sit here and say, but we're not committed to anything because we didn't have to talk to you folks about it. Can we bring the honeycomb up now? Thank you. Mr. Parrish, I want to bring this project down to earth. If you can find commercial software to meet your requirements, you may be able to succeed. Otherwise, you'll wind up like the EHR Modernization program, paying a company to rebuild its software to meet your needs. We're up there. Okay. Mr. Parrish, this VA's diagram of all its systems related to supply chain. Yes. I think that you're familiar with this.
Very much, yes, sir.
What is the commercial software, either as one system or a combination, able to accommodate out of that honeycomb right now?
Well, Congressman, I don't know any particular singular solution that does that, as I mentioned. And, back to your earlier point, we are...
So do you know of any system that is able to accommodate some part of that you're talking to?
I think there are a couple of known products that we are using already that could take over some of those different sections, but I'm not going to comment on current technology.
Dr. Miller, which of these systems are you planning to keep and integrate with the new software? Approximately how many new systems do you expect to buy, and how will all that work together?
So, Congressman, to answer your question, what do we expect to take offline? That is an unknown right now. As we work through the objectives and the requirements of what the functionalities are, then we'll assess each of these to see which can come offline at that time.
Okay, so this is heading us down the exact path that we saw EHR go through, and that is we want to develop a system that's going to accommodate all this data. It's going to accommodate the pharmaceutical department. It's going to accommodate all the records for the veterans, and it's going to flow very smoothly as we were told. And yet, all these different components have never been put together by one software company to manage all of that data before. And so we, as taxpayers, are on the hook now for a $9 billion system that's supposed to be functioning at 179 hospitals, and it's rolled out at 5 and isn't even fully functioning at them. I am very concerned, again, that you are heading down this exact same path where you're going to get into work orders, you're going to get into these different contracts that are making long-term commitments based on additional components being brought in that a current software company is not able to accommodate right now, that we are going to be on the hook for. And this is how, unfortunately, I believe that you're avoiding bringing all of this information before this committee, because you're taking a small component at a time and you're putting us on the hook for all of that. Mr. Parrish, when your requirements are this massive, you limit the pool of companies that can compete for this work. And we've had many hearings about that. We held a hearing last May examining this exact problem. Did you consider this problem when you came up with your strategy, and do you agree that it's even is a problem?
I do agree that single contractors or vendor lock are a major problem inside federal government. And I think that a key component of this is maintaining that main flexibility. What we're not buying, to your earlier point, Congressman, is we're not committing to a singular technology. We're committing to partnering with someone who has a service who then can find those multiple technologies. Again, it's sort of like a Rubik's Cube. It's subcomponents. It's not a singular silver bullet. It's 7 to 10 different type of technologies for that honeycomb structure that you show, which is also a great win when we finally figured out how many different systems we had. That was up in the very beginning of this as-is process. And we're not committing dollars. We're committed to solving the problem, but we're not going to commit taxpayer dollars or technology, something that's going to be obsolete in a year or two, that we're going to be stuck back here again, to your point, Congressman.
Well, we expect for you to be back here before us as we go through this process. As Mr. Beard has said, we have already established that you are going to be well above the threshold in order to keep this from this committee. So we expect to have you back before us on a regular basis now. That I yield back to Ranking Member Sherfless McCormick.
Thank you, Mr. Chairman. One of the foundational issues the VA cites as a barrier to effective managing the full supply chain modernization effort is adequately staffing levels, citing that these responsibilities are often an additional duty rather than a core responsibility. What steps is the VA taking to bolster its modernization workforce? And amidst the rollout of several modernization efforts, like supply chain, the electronic health records, and others, why has the VA not prioritized the modernization workforce?
Well, ma'am, I'll start and then I'll pass it to my colleagues. I will say that one of the successes we did with the HR program, if you recall from last year, was establishing dedicated functional champions. And taking that lesson learned as a best practice inside this program of supply chain is we have functional champions from those different functional groups, pharmacy and whatnot, that are dedicated to doing this effort. And we have teams that are co-located between OIT and VHA that are dedicated to this project. And I don't know if you want to add on there.
So I can't speak to what the other components of VA are doing around modernization workforce. In terms of the IT department, our entire workforce is committed to becoming a continuously evergreening model of software. So we've done a lot to componentize our software, to make APIs and platform-based decisions so that we can continuously modernize without doing big bang waterfall-based projects. So you can see this in our approach to va.gov, to our flagship mobile app, to our benefits platform, where we're able to break things into small pieces and update them without breaking the entire system, so that components seamlessly update throughout its life cycle. So that's a mindset and skill set shift we've undertaken in the Office of Information and Technology. We're committed to continuing that in perpetuity because that's just the way modern IT systems are delivered. Again, the modernization workforce outside of OINT, I can't speak to how they're applying the similar principles.
Ma'am, will Dr. Miller?
Ma'am, I'll speak to the supply chain modernization effort. Currently, as I spoke to Congressman Self, the Valor program is sufficiently staffed for its current activities. The personnel that are there are adequately certified and credentialed for project management as well as program management and acquisition management at a higher level. So we are appropriately staffed at the current time.
And what barriers are you facing in recruiting talents when it comes to implementation and hiring and keeping employees?
I think we face the same barriers as the rest of the federal government when it comes to certain certified positions. It's because program management requires certain certifications, and not having and finding the qualified staff with those certifications is a challenge for all of us. So what we do is when we bring in staff, we train our staff internally to get those certifications, to build them up.
Go ahead.
No, that was it.
Do you have any recommendations that you'd like to bring forth on how we can help you overcome those barriers to acquiring talent?
Not at this time, ma'am. I owe you a response for that.
Mr. Parrish?
Well, ma'am, I think that, to Dr. Miller's point, I think that the challenge on federal government is the way the entire federal government acquisition or hiring process is. It takes significant time. And, you know, when we find qualified candidates, taking 3 or 4 months to vet them and get them on board, by then they'll already have found another job and they won't wait for us. And that's an observed and acknowledged problem across all of government.
Now, the demos project faced several setbacks as identified by the committee and the VA's Office of Inspector General. We had a number of hearings last Congress and sent numerous letters expressing the flawed approach that VA was taking. What steps has the VA taken to reinforce its acquisition framework requirements and rectify the mistakes of the past to ensure it will be investing in a solution that meets the requirements of its workers?
So I think the biggest thing, Congresswoman Surface McCormick, is I was one who kind of initiated the effort with our OIT and VHA teams to identify that it was above budget, behind schedule, and not delivering what was promised. And so we've taken those challenges and applied it to this process here. This is why it's a services-based contract, not buying a single technology that otherwise will be obsolete. The evergreening idea is sort of like is the idea where technology can renew and refresh over time. So once the technology becomes obsolete, the obligation on the services winning bidder or vendor is going to have to apply any new technology. That's why we're technology agnostic more than we are buying a piece of hardware or buying a piece of equipment or software that we're going to be locked into for 10 or 20 years. We're focusing on taking those steps methodically and with the field up front to ensure that we're getting what we want and we're buying, and we're not going to commit to moving forward unless we know for sure, testing it, that it is working. So we're not going to rely on a contractor to tell us what it is we want. We've got standardized service level agreements. Part of another best practice we took out of the HR effort, if you recall, from last year, was those service level agreements are become the standard across all of these major programs. So they're incorporated here inside the supply chain modernization effort as well. So the vendor has the obligation to pick the technology. We have the obligation, and we have the oversight and the checks and balances to make sure that we're not going to buy something that's going to be obsolete or buy that service. And that's exactly why we're having these toll gates, these small, methodical, slow toll gates. So we're not committing these billions of dollars on what you see on that piece of paper there.
Thank you. I yield back.
Thank you very much. Representative Self.
Thank you, Mr. Chairman. We've talked a lot about this services contract. This is an IDIQ contract.
Yes, sir.
That scares me to death because this is what gets out of hand. And we're $34 trillion in debt. My colleague, Mr. Crane, is not here today, but always makes the point that dollars are going to be really scarce in the future. I think we just need to realize that. And an IDIQ, even if you got all of your validation down and you were confident going forward, IDIQ scares me to death going forward. I don't understand the chain of command. Would you just, for just 3 organizations, VHA is the SCM executive agency. Then you've got Valor underneath the VHA, I believe, and then you've got the Enterprise Supply Chain Board. Is the Enterprise Supply Chain Board the senior organization in this chain of command?
No, sir. And if I can go back to your comment about IDIQs, I think the greatness of the IDIQ is we do the actual obligation of funds based on task orders. And so we're not committing billions of dollars up front. We're only committing a little bit up front.
Yeah, but this is where it gets out of hand because you nickel and dime Congress to death. That's what I have. That's the problem I have with an IDIQ.
Understand.
Because long history with IDIQ, That's what happens, is once you establish the program and you start these task orders, they just start rolling. So I'm very concerned about that. I think Congress needs to take a hard look at the IDIQ nature of this contract, because I want to know how you're going to cap this thing. I don't care if it's $12 billion or $1 billion. How are you going to cap this IDIQ?
That's exactly through that governance structure you were asking about. So I'll start from there, sir, is we designated the Valor Office as part of VHA as the executive agent. And then the Enterprise Supply Chain Board is an enterprise across the entity with all stakeholders involved. And that's co-chaired by my deputy along with Dr. Miller. And that reports up to the operational aspect of supply chain is on that VHA side. I am the program decision authority from the acquisition decisions, if you will, for getting through the milestones. The next level up above ESCB, not as a senior authority, is our VAOB, which is our VA operating board, which is chaired by the deputy secretary. And from there it goes to the VAEB, which is chaired by our secretary.
So you're the CAO?
Yes, sir.
Because I didn't understand that. So you're the actual CAO that you reference here?
Yes, sir.
So go through the chain of command again. I've got a couple of minutes. We've got time to do this because I want to understand.
Sure. So at the operational level it's the Valor Office. So that's the day-to-day cost schedule performance effort. From a supply chain management, beyond just the contract, the management structure, it's the ESCB, which is the Enterprise Supply Chain Board. And that board consists of the functional, champions of functional members from each of the different organizations.
To include the cemeteries?
Including cemetery, yes, sir.
Okay,
Including hospital, everyone else. So
question, but okay, go ahead.
They're at the table, along with OIT and
Right.
the lawyers and otherwise.
Right.
From an acquisition standpoint, this is where I am the decision authority from an acquisition component. ESCB also then goes up to, both of us then go to the VAOB, which is led by our Deputy Secretary, Bradshaw. And then above the VAOB is the Secretary, who is the ultimate decision authority, the VAEB, the Executive Board, Operating Board, Executive Board. So that's how it flows up. But day-to-day operations is with Dr. Miller.
Okay, that helps my understanding. And you may be about to address this, Mr. Chairman, but I think we need to be looking at HR 2499. I just do. And if you don't address it, I will. So thank you, Mr. Chairman. I yield back.
Thank you very much, Representative Self. Dr. Miller, I want to dig into what you're requiring the contractor to do so that we can establish this work. You have 10 big requirements, each of which would cost hundreds of millions of dollars. Let's start with the high-tech medical equipment. X-rays, MRI machines are a lot different than bandages and gloves. Roughly how much high-tech medical equipment does the VHA have now, and how many machines do you buy in a typical year?
Congressman, I'm not able to answer that question. I owe you a response on that.
Okay, have you estimated the cost of the systems to manage the high-tech medical equipment supply chain?
The current system we have or the new system?
Going forward, have you estimated the cost of the systems to manage the high-tech medical equipment supply chain?
So
that segment.
So the process is the functionality we inventory for all equipment and supplies across the enterprise. So in the validation phase, which I haven't seen the proposal, we'll get the proposal and we'll validate what the awardee states that they can do and what that cost will be.
So you have not estimated the cost of the system to manage that high-tech segment of the supplies that you're.
In the independent government cost estimate that is laid out, Congressman, and I don't have that in front of me because it's acquisition sensitive, so I didn't bring it with me.
And Congressman, if I can add to that, what we don't know is, for us here on this panel, is we don't know what was in the proposals because we've not awarded the contract yet. But in the proposals, there is a number somewhere that we are not privy to. Because it's still source selection sensitive, but there is an estimate in there for each one of those components, because that was one of the deliverables out of the solicitation.
Okay, and see, this is the kind of information, again, that we need to have, and without having the proper people here to provide it for us, we're not able to do our jobs.
Correct, and I don't think any of us could provide that to you just yet, because we don't know it.
Mr. Beard, VA's request for proposal also includes the IT hardware and software supply chain. According to OIT's budget, you support more than 1.95 million pieces of IT equipment, including 600,000 computers and 120,000 smartphones. How many systems do you have now to order, receive, inventory, and dispose of all that hardware? How many systems do you have now to take care of that?
So ordering, we use a standard ordering process. We use a couple of different systems in VA to receive the equipment. So we have Maximo at some facilities, and we have our old Vista IFCAP system that we use, our Ames MERS, to bring supplies in through the warehouses.
And to inventory and dispose of the hardware as well?
Correct.
Okay. Mr. Beard, are you expecting to consolidate all those functions into one system? And how do you envision that working as we move forward?
So again, I would love to have one system, but I do not know what the proposals have come back as. So I cannot speak to what our ultimate product would be. It's too early for me to say that there would be a product.
Okay, again, what this demonstrates is that the people that are here to provide us information don't have the information that we need in order for us to do our job. Mr. Parrish, another one of your requirements is facilities management. Roughly how many buildings does the VA have, including owned and leased, and how many VA employees maintain those buildings?
I'll have to take that for action, Congressman. I'm not aware.
Okay, Mr. Parrish, how does facilities management relate to medical supplies or high-tech medical equipment or IT hardware? And what benefit do you expect to realize from integrating all of those functions together to justify the cost?
Again, Congressman, it's a separate subcomponent of this overall idea. So it's not going to integrate necessarily from a technology solution to the medical surgical prime vendor. I will add that for example, part of the challenge is not having this visibility, and that's what the technology solution is going to get us, is like, what is the status of a certain facility? For example, pharmaceuticals, some of the CMOPs, some of the pharmacy efforts are inside some of the facilities that we have. To understand that and to understand how those systems are operating, understanding what the maintenance status is or what the preventive maintenance is, all that's the kind of information that we look to get out of this effort, which we don't
Look,
have.
I understand that, but here's what I will tell you. Having an extensive real estate background myself, okay, the guy who's managing the grounds and the building for the pharmacy doesn't know how much penicillin's going out that week. Okay, they are two different things.
Yes, sir,
And,
that's right.
and so to try and integrate all of that information together doesn't sound like a really good idea to me.
And that's what
I
I will
yield to Ranking Member Surplus McCormick.
Thank you, Mr. Chairman. Mr. Parrish, both GAO and OIG have voiced continual concerns regarding the acquisition design and implementation plans for the supply chain modernization project. GAO specifically included 5 leading practices for effective pilot design to include establishing clear and measurable objectives, data collection strategies, implementation plans, and stakeholder communication pathways. Do you feel that the VA's approach to the supply chain modernization efforts have followed these practices thus far? If so,
Yes, ma'am. When we get to the pilot phase, we absolutely do that. And to go back to Chairman Rosendale's comment, we are not integrating between pharmacy supplies and facilities. So each one of those components, when they do the pilot phase, will be separate and distinct to their specialty and to their area. But we are working with GAO, and we have those best practices along with OIG to make sure that we're incorporating those into that phase when we get to there.
I believe you mentioned that you have defined successful matrix for the validation phase of this modernization effort. Did I hear you correctly?
Repeat the question again, ma'am.
That you've identified successful matrix for the validation process?
So we've identified success measures of this program, which is enterprise visibility of, as I mentioned, asset management, order management. Asset management applies to the facilities. Order management applies to ordering systems, widgets, or whatever. Inventory management applies to knowing how many cotton swabs we have across the enterprise and in each VAMC, which, as you rightly mentioned, ma'am, we identified that gap during COVID when we have to go out and count manually what all these items are. And then the last one is supply chain risk management, to understand multiple levels down where the material is coming from, China or otherwise. And that's the kind of visibility that we are looking for the definition of success.
And did you define these matrices, or did the vendor define these matrices?
Oh, and definitely not the vendor, ma'am. This came from the field. I'm not a vendor person, so I do government-only meetings.
And how will you ensure that these matrix that come out of this actually measures the success of the product?
And that's exactly where the pilot phase comes in, and that's also once something's deployed, there's, just like we have in those established now service level agreements from EHRs, is there's continuous on a monthly, quarterly basis, whatever gets established, the reporting structures. The other part we're including and looking at including is independent validation and verification, and not just independent from a vendor doing it, but independence. So there's no dependency of whoever's doing that validation to have that separate, and that's kind of a big, operational thing that we need to incorporate into this going forward. So that's years down the road, but we're looking at incorporating that in other projects right now as well.
As these matrices and requirements are addressing during the validation phase of the supply chain project, will you commit to sharing these documents with the committee?
Yes, ma'am.
Thank you. I yield back.
Thank you, Ranking Member Surplus McCormick. Recognize Representative Self.
Thank you, Mr. Chairman. How much independent authority do your, and I'll call them senior directors across all of your enterprise, have, for instance, VISN directors? Because you're going to establish a services contract, and from my limited experience, they are so individual in their authorities in each of the major medical centers, for instance. Are you sure that what you provide, what you determine will be the project, is going to be accepted by your senior directors? What independent authority are they going to have to do something different? Because there's where the nickel and diming comes in. Because if your VISN directors, for instance, and there are many, many other enterprise across the enterprise, but just taking those for instance, there's where your IDIQ could get out of control. So how in the world are you going to limit their authority to run their medical center in the way that they see fit? Because one size does not fit all.
And Congressman Self, thank you for that question. And I would say that we've spent a lot of time, and this is why we've not committed billions of taxpayer dollars on this, to make sure that we've got jointness across the enterprise. And we've worked with the field, the VISN directors and the VAMC directors, to make sure that they're buying into this, because we don't want the challenges when something gets deployed that nobody accepts. And that's the qualitative aspect. That's why the concept of human-centered design and change management is done at the very beginning before we even start spending a dime. And that's where a lot of the processes have been done to improve this. Today, separate from this, or as part of this, is the idea of category management. We're working on standardizing some contracts to make their life easier. That's the really intent of this, is to make our VA teammates out in the field make their lives easier to order equipment and make sure it's delivered there on time when they need it. And I don't know if you want to add anything to that, Dr. Miller.
Okay, I go back to the 5-month project for validation. 5-month projects probably don't scale to a 10 or 20, depending on which you read here, project. I'm very concerned about the way you have structured this, and I think to protect the American taxpayer, Mr. Chairman, I'm recommending that we take a look at the $24.99 in full committee, and I recommend we take that to the full committee and examine it based on the information that we are just now getting out of the VA. With that, I yield back.
Thank you very much. Mr. Parrish, you have told us that the VA is buying functionality, not software, but you've been describing a process where the VA pays a contractor to tell you what software provides the functionality that you need. How are you going to know whether their advice is biased or not before we start obligating ourselves to big dollars?
I think a key component of that is that IVV process that I talked about. But the other comment I'd make, Congressman Rosendale, is the fact that we're not relying on the contractors to tell us what we need. We have specific objectives that we expect them to deliver. For example, I'll use just a cliche of scrambled eggs when you go to a diner. We're not going to dictate, we're not going to over-engineer something to a vendor to tell us if we want the size of the spatula or the temperature of the oven. We just want our scrambled eggs on time and on budget, and that's what we're expecting them to deliver. How they do it is up to them. We don't want to be locked into a single vendor. Just for example, I grew up under Jack Welch in my GE days, and if we have to rely on a vendor to tell us how to do our job, we don't need ourselves.
So I mean, that sounds like a great answer. The problem is when we bring the honeycomb up and we show you all the different components that you need to address, and you can't really answer any questions about how much of that's going to be removed, how much of that's going to be connected, and so you are relying on the contractors. The contract structure, scope of work, and technology challenges for the supply chain modernization project all sound very familiar and similar to what we have been dealing with in the EHR modernization. And quite frankly, we have paid $9 billion out for Oracle to use taxpayers' money and veterans as guinea pigs so that they can develop a new system. That's what it's been used as. The veterans are being used as guinea pigs, and the taxpayers are footing the bill for this grand experiment. And this project sounds very similar to it. How is it going to be different?
I think the big thing is we've said here multiple times, Congressman Rosendale, is we're not committing billions of dollars up front on day one. We're making sure they prove it to us that a system works. And we're making sure that the field is the one that's accepting this at that pilot phase. And once we know that, once we're able to mitigate that uncertainty, not having imperfect information, understanding what it is that we are actually going to get, then we can make that informed decision. But we can't make that informed decision up front saying we're going to commit billions of dollars today when we don't even know what the offer is, to your point, Congressman.
Again, but if we're going to be phasing this in and we're making financial obligations and we haven't had any kind of commitment or information dialogue back and forth from VA about this process, we don't know, quite frankly, what you're up to. We don't know what these agreements are going to look like, if they're going to be obligating the taxpayers later on for additional work and for improvements. And we have not seen so far from the VA their judgment being very sound about investments in software programs based on future promises of how they're going to perform. With that, I would yield to Ranking Member Surplus McCormick.
Thank you, Mr. Chairman. The fiscal year 2025 budget request proposes major cuts in OITs and OIT's IT modernization funds. How will you ensure that the supply chain modernization efforts get the resources it needs to be successful?
Yep, thank you for the question. So we understand that the 25 budget really has no development and modernization funds in it, very, very minimal. We do have two-year funds. Our development and modernization funds are two-year funds. We're planning to use in FY24 our 23-24 funds, and then in 25 to use our 24-25 funds to carry this through at a very modest level just to get us through the pilot. We would submit anything that we learn from this, additional budget requirements would go into the 26 budget and beyond. And again, understanding federal caps on spending, there would be severe trade-offs within VA to establish any additional funds above these very modest levels, based again, as Mr. Parrish said, on the functionality that we think could be accomplished with the resources available to do anything meaningful.
Thank you. I yield back.
Thank you very much, Ranking Member Surplus McCormick. I now yield to Representative Self from Texas.
Thank you, Mr. Chairman. How many primes bid on your or responded to your RFP?
We did this process, it was, again, a methodical process from the very beginning. We had a multi-phased effort. So first phase, we looked at the past performance and the fiscal ability of said bidders to be able to meet the goals that we were looking for. So that whittled it down to, I believe, 4 or 5 bidders. Then we have the traditional multiple layers of volumes of paper, if you will, for the different offerings. And we were able to get it down to some finalists. And the other unique thing we added into this process was we had that final test drive of based upon some use cases. We had the field again. The guys actually, the grunts in the field actually doing the logistics, coming in and test driving those finalists, and that's where they've picked that final potential winner that we don't know about yet, because we're still trying to establish our final checks and balances, if you will, before we commit to actually going forward.
So you may not be able to answer my next question. Is Microsoft in the final tranche?
I don't know that. I'm pretty sure from what little I know is they weren't one of the actual bidders, and is a prime.
Okay. It is a real problem in the defense industrial base, the limited number of primes that we have. And I think it probably is the case in the IT world as well, especially with the size of this. Do you have any security concerns about cloud-based enterprise system?
Very much so, absolutely. And we make sure that we're complying with all the laws and all the cyber rules and zero trust and also the FedRAMP rules and requirements. And those have been baked into some of those in the proposals. I don't know if you want to add anything to that or.
Nothing is safe, Congressman. On-prem, in cloud, unless it's buried in the ground and unplugged from anything. So it really, some great benefits come from cloud-based solutions where vendors really have dedicated teams focused on hardening those, especially our FedRAMP and high requirements for those cloud providers. We really would insist on those same things for any of our cloud providers. Again, nothing is safe. That's why zero trust is a very important framework for us, and where we're looking everything we buy to make sure that we limit risk.
I yield back, Mr. Chairman. Thank you.
Thank you very much, Representative. I now recognize Ranking Member Surplus McCormick for her closing remarks.
Thank you, Mr. Chairman. I appreciate the testimony and answers from our witnesses this afternoon. Our last oversight hearing on this topic was November 2021, which predated my time in Congress. I believe this hearing has been a necessary and helpful step in the committee's oversight over the supply chain modernization efforts. From what I've heard here today, I believe we can all agree on one point. Providing a modernization enterprise-wide supply chain solution is an incredibly complex process. How VA steps forward in these next phases will be incredibly formative for the pilot program and a potential deployment of a new supply chain process. It is absolutely imperative that the VA works towards directing and implementing matrix of success through all phases of this modernization rollout. If VA wants to reach a fully efficient and effective model, it must put in the work to ensure that these outcomes actually exist. VA cannot idly sit by as its vendors develop, modify, and implement these systems. The road to an effective and enterprise-wide solution is before us. While I maintain my concerns, I look forward to working with everyone, both in the VA and with the chairman, to ensure that the VA is prepared to implement a solution that supports all of VA's supply chain needs. Thank you, and I yield back.
Thank you very much, Representative Surplus McCormick. I want to thank the witnesses for joining us this afternoon. I'll be following up to make sure the subcommittee gets the information we need from the witness who did not appear. This project does not seem to have the confidence of VA's senior leaders, and unless I see some radical improvements in transparency, it will not have my confidence or support either. The only fact that we have established here today is the VA's obligation to report and request funding for this proposed project instead of keeping this committee in the dark. I ask unanimous consent that all members have 5 legislative days to revise and extend their remarks and include extraneous material. Without objection, this meeting is adjourned.